Hello everybody, this is Dr. Kukreja A Kalani. I'm a practicing homeopath, practicing since last 24 years at Powai, Mumbai. So today I'll be talking about dermatitis. It's a very broad term and it includes a lot of subtypes, plus the symptoms are very important, and the approach towards treating of the ailment is to be understood so as to get permanent and long-term solution to the problem. So what are the causes, symptoms, risk factors and care to be taken? So let's begin. Dermatitis is an inflammation of the skin that can cause redness, itching and irritation. It includes various types such as atopic dermatitis, contact dermatitis, seborrheic. So let's begin with atopic first. So what are the causes, risk factors and aspects of care will be discussed in detail. So atopic dermatitis is a chronic condition often linked to allergies causing dry and itchy skin. Contact dermatitis is basically from allergens or irritants such as soaps and chemicals. Seborrheic dermatitis affects oily areas leading to dandruff or red and scaly patches. Nummular dermatitis is basically a coin-shaped itchy spots on the skin, often due to dryness. Stasis dermatitis, it affects in the lower legs because of poor circulation. And dyshidrotic dermatitis is basically it affects the palms and the soles, causing blisters on the skin. So what are the causes of dermatitis? First is the irritants and allergens. Contact with chemicals such as soaps, detergent, cleaning products can cause irritation. Fragrances, nickel, certain plants or latex can trigger allergic dermatitis. So, family history, a genetic predisposition, particularly for atopic dermatitis often runs in families with a history of allergies or asthma. Immune system dysfunction, overactive immune response, it's an exaggerated immune response can lead to inflammation as seen in atopic dermatitis. So what are the environmental factors? Dry weather, heat and sweating, microbial presence, that is the presence of fungi and bacteria. So basically seborrheic dermatitis is linked to the presence of type of yeast which can affect the skin. Now we come to the symptoms of dermatitis. What are the symptoms? Redness and inflammation. Patches of red skin are common with most type of dermatitis. Mild to severe itching. The most common symptom is scratching, which worsens the condition. Rough patches, the skin may feel dry, rough, flaky, especially in atopic dermatitis. In contact dermatitis, the skin may develop blisters sometimes which are oozing or crusting. Crusting can happen over the affected area. Scaling or flaking, that is the skin peeling. The flaky skin is common in seborrheic dermatitis, often affecting the scalp and areas rich in oil glands. So what are the risk factors for dermatitis? So it's basically genetic. A family history of eczema, hay fever or asthma increases the risk of atopic dermatitis. Infants and young children are more vulnerable, and very often we find this cradle cap in infants. Next is the occupational exposure, that is exposure to chemicals or irritants at work. Skin conditions can be aggravated by allergies, so people with existing allergies or asthma are more vulnerable. Environmental factors which aggravate are cold, dry climate, high levels of pollution. So, what is the care that is to be taken for a person who is suffering for dermatitis? So, the suggestions are basically regular moisturize the skin so as to prevent dryness, avoid the irritants or identify the triggers such as use of harsh soaps, perfumes or certain fabrics, and know your allergens and avoid exposure to the same. Wear gloves when using cleaning agents to prevent contact dermatitis. Use mild fragrance and fragrance free cleansers and avoid hot water to reduce the irritation. After bathing, pat the skin dry instead of rubbing it because it can lead to further irritation. Wear clothing which is soft and use breathable fabrics. Avoid use of wool and synthetic materials. Next is, which is the most important, is stress reduction, that is to how to manage stress. So you can incorporate techniques such as yoga, meditation, deep breathing, which can prevent the flare-ups. So caring for dermatitis involves protecting the moisture and moisturizing the skin, avoiding known triggers, and managing environmental and emotional factors. Regular and gentle skin care can help minimize symptoms and improve overall skin health. Homeopathy has been very effective in treatment of dermatitis because it alters and improves the immune system, and has the results are long lasting, and the complaints do not recur that often. So always you can think about homeopathy as an very important solution to skin problems, because local applications have very minimal role to play. This is Dr. Kukreja A Kalani signing off. Thank you.